This edition of Ask the Doc, I will cover a common question I get on the cause of carpal tunnel syndrome and how to fix it without injections or surgeries. Expect to learn what exactly does carpal tunnel syndrome mean? What causes carpal tunnel syndrome to occur? Will wearing a brace help fix it? Are cortisone injections helpful in fixing it? Is carpal tunnel release surgery effective? And how do we get it fixed safely and effectively? For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, sciatica, and hip pain. My focus is on finding and fixing adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long lasting pain relief. Back at it for Ask the Doc. Just a reminder, if you have neck, shoulder, sciatica, or hip issues and you're struggling to get some real answers as to what is going on, you can submit your questions directly to me. And if my insights can help, I will be sure to get a video out to you. First off, what exactly does carpal tunnel syndrome even mean? It really doesn't tell us a whole lot. And in the medical world, it gets confused for any issue in the hand or wrist. People automatically assume, oh, I have carpal tunnel syndrome, but it doesn't really tell us anything. A lot of times when I see a diagnosis out there with syndrome in it, it's usually just a code word for they really have no clue as to what's going on and they have to call it something. Usually they have to do that to appease the insurance companies and have diagnostic codes for everything, but it doesn't really tell us exactly what's going on. It's just saying that there is some type of pain in the elbow, in the wrist, in the hand, but there's a lot of issues that can cause that aren't just specifically carpal tunnel syndrome. So what causes carpal tunnel syndrome to occur in the first place? Most of the time, it's this nerve getting stuck. It's called the median nerve, and I'm going to link it up right here. And you can see it has a long way to go. It starts all the way up at the base of the neck and then works its way down through the armpit, through the middle of the forearm, and down to the wrist and into the hand as well. So over time, with bad postures, maybe some accidents, lack of movement, lousy diet, all sorts of things, the muscles get overworked. And when they get overworked, they don't get enough blood flow and they don't get enough oxygen. And the body actually thinks there's an injury there. So it starts to lay down this stuff. It's called adhesion, also known as scar tissue. It's like glue that gets inside the muscle. And it really makes it hard for muscles to stretch and contract how they're supposed to. What else happens is nerves have to make their way through the whole body and the whole track. And nerves are built with about 15% of extra slack, like a rubber band, to keep it healthy. What happens over time is that scar tissue and that adhesion gets bigger and eventually it gets stuck to the nerve. And when this happens, it creates numbness and aching and burning and tension down that whole area. And it can get caught anywhere. That median nerve is very big. And like I said, it can get caught in the neck, the armpit, middle of the arm, and even down in the wrist, down here in the carpal tunnel itself. So will wearing a brace help fix it? Not really. It can support it and slow it down, but it's not going to actually fix the problem. You know, I always say the nerve getting caught is kind of like a cavity, and it needs to be specially treated with the right amount of tension, the right amount of depth to actually free that up. And wearing a brace is kind of like brushing and flossing. Yeah, it's super helpful, but it's not going to fix a cavity. Question I always get on pretty much every video that I make is, are cortisone shots or injections going to be helpful in fixing any injury, specifically carpal tunnel? The short answer on that is a hellfire no. I cannot emphasize any further how much cortisone shots are garbage, and so are the doctors that are giving them. Because basically what happens is all cortisone does is it goes in and gets rid of some inflammation, takes pain away. It didn't fix anything. Kind of be like the pain is like your check engine light came on and you go to the mechanic and they just unhook that, but they don't fix anything. It's the same thing with the cortisone injections. Why it does temporarily fix your symptoms and makes you feel better, it didn't improve anything. And any treatment that only improves symptoms but not function is actually very dangerous. And even worse, they've shown in studies with repeated cortisone injections, you can actually cause more damage to the joint, to the cartilage, to the muscles itself, and it causes a bigger problem. So yeah, it might get you out of a short-term feeling pain, but you're going to have to deal with that a lot worse down the road. So avoid cortisone shots at all costs because they're not worth it. They make things worse. And honestly, if that's the first thing a doctor offers you, run far, far away from them because they're not going to help your problem. They're going to make it a lot worse. Now, is carpal tunnel release surgery effective? This is one of the main surgeries that they do. They actually do it in outpatient now, so you don't even have to go into the actual hospital. So they're prescribing it a lot more and more because the insurance companies are paying for it. So will it actually be effective? It really depends on a lot of aspects. First is, was there trauma or no trauma to the actual wrist or the palm of the hand? A lot of times when that does happen, a carpal tunnel release surgery can help. But if you have a history of elbow problems, maybe shoulder or neck issues, more than likely that symptom that you're feeling down in the carpal tunnel is actually coming from somewhere higher up. So if they go in and release this part, but they don't fix any of that, you're going to actually have to deal with that problem a lot worse down the road. And another one that I look at too is when people do come in to my clinic that might have had carpal tunnel on one side, then they start to get it on the other side as well. That's telling me more there's actually a problem with the neck and the nerves as they go down. It's not an actual carpal tunnel problem itself. So the carpal tunnel tingling and the pain down there a lot of times is the effect, but it's not the actual cause. So how to get it fixed safely and effectively. What I want to show in this week's video is a demonstration of me treating one of the most common areas where the median nerve can get entrapped, which is in a deep muscle in the middle part of the forearm. It's called the pronator teres. So I'm going to link that video up right now so you can see what a detailed treatment looks like.
So let's trace the median nerve back up. So then it comes in here and it actually goes through this tunnel in here, and that's called the carpal tunnel. And where it makes its way up is right here through the medial part of the elbow and the arm. And where it can actually get caught is first really deep in here. There's a muscle called your flexor digitorum superficialis. I practiced that one. Flexor digitorum superficialis. And then the other one where it comes in is the pronator. So the pronator kind of comes from the medial side and goes like that. Depth into the muscle, into the nerve, and then I tension right there. And then she's shortened, and I'm going to open up the elbow just like that. And I'm going nice and slow, and it's sliding under here. That's where it opens up, and she'll feel that a little bit more. And then I'm going to pull those fingers through just like that.
So a couple take homes from the video. The treatment is very precise and it's focused and it's slow. We describe the treatments as something that should be moderately uncomfortable, but not excruciating. And a lot of times when people get treatments from manual therapists, it hurts like hell. And they think because it's hurting that it must be doing something, but it's not in this case. It's actually just jamming that nerve in there and making that problem a lot worse. That's all I got for you guys in the video. If you've been dealing with chronic wrist pain and carpal tunnel syndrome like pain for at least 6 months, you've seen way too many providers and you're still having issues, then reach out to us directly to set up an injury consultation to get some real answers as to what is going on and get on the path to long-lasting pain relief so you can stay the hell away from pain pills, injections, and surgeries that only make things worse. All the information to request a consultation is in our profile or wherever you're consuming this video. I appreciate you watching, and we'll see you on the next one. Bye.